Ora serrata, ora serrata, ora serrata, oral serrata. Ciliary process, ciliary process, ciliary process. Iris, iris, iris. Lens, lens, lens. Pupil, pupil, pupil. Interior chamber, aqueous humor. Interior chamber, aqueous humor. Interior chamber, aqueous humor. Anterior chamber, aqueous humor. Posterior chamber, posterior chamber, posterior chamber. Suspensory ligaments, suspensory ligaments, suspensory ligaments, suspensory ligaments. Ora serrata, ciliary process, iris, lens, pupil. Anterior chamber, aqueous humor. Aqueous humor, anterior chamber, aqueous humor. Posterior chamber, posterior chamber. Suspensory ligaments, suspensory ligaments, suspensory ligaments. Ora serrata, ciliary process, iris, lens, pupil, anterior chamber, aqueous humor. Posterior chamber, suspensory ligaments. Ora serrata, ciliary process, iris, lens, pupil, anterior chamber, aqueous humor. The aqueous humor and the anterior chamber are the same thing. Posterior chamber, suspensory ligaments. Lateral rectus muscle, lateral rectus muscle, lateral rectus muscle, lateral rectus muscle. Retina, 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 retina. Choroid, 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 choroid. Sclera, sclera, sclera. The white of your eye is the sclera. Fovea, fovea, fovea. Fovea, fovea, fovea. Lateral rectus muscle, retina, choroid, sclera, fovea. Lateral rectus muscle, retina, choroid, sclera, fovea. Lateral rectus muscle, retina, choroid, sclera, fovea. Lateral rectus muscle, lateral rectus muscle, lateral rectus muscle. Retina, retina, retina. Choroid, choroid, choroid. Sclera, sclera, sclera. Fovea, fovea, fovea. Retinal arteries and veins, retinal arteries and veins, retinal arteries and veins, optic nerve, optic nerve, optic nerve. Vitreous chamber, vitreous chamber, vitreous chamber. Hyaloid canal, hyaloid canal, hyaloid canal. Retinal arteries and veins, retinal arteries and veins, optic nerve, optic nerve, optic nerve. Vitreous chamber, vitreous chamber, vitreous chamber. Hyaloid canal, hyaloid canal, hyaloid canal. And you can't see the medial rectus muscle, medial rectus muscle, medial rectus muscle. At the bottom there's the medial rectus muscle, medial rectus muscle, medial rectus muscle. The top muscle is the lateral rectus muscle, the bottom muscle is the medial rectus muscle. Lateral rectus muscle is the top muscle, medial rectus muscle is the bottom muscle. Clockwise, lateral rectus muscle, retina, choroid, sclera, fovea, retinal arteries and veins, optic nerve, vitreous chamber, hyaloid canal, medial rectus muscle, suspensory ligaments, posterior chamber, anterior chamber, aqueous humor, pupil, lens, iris, ciliary process, ora serrata. Lateral rectus muscle, retina, choroid, sclera, fovea, retinal arteries and veins, optic nerve, vitreous chamber, hyaloid canal, medial rectus muscle, suspensory ligaments, posterior chamber, anterior chamber, aqueous humor, pupil, lens, iris, ciliary process, ora serrata. Lateral rectus muscle, retina, choroid, sclera, fovea, retinal arteries and veins, optic nerve, vitreous chamber, hyaloid canal, medial rectus muscle, suspensory ligaments, posterior chamber, anterior chamber, aqueous humor, pupil, lens, iris, ciliary process, ora serrata. Cross-sectional view of right eye. Lens, iris, suspensory ligaments, cornea, canal of Schlemm, ciliary muscle and body, conjunctiva. Lens, iris, suspensory ligaments, cornea, canal of Schlemm, ciliary muscle and body, conjunctiva. Lens, 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 iris, 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 suspensory ligaments, suspensory ligaments, suspensory ligaments, cornea, 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 canal of Schlem, canal of Schlem, canal of Schlem, ciliary muscle and body, ciliary muscle and body, ciliary muscle and body, conjunctiva, conjunctiva, conjunctiva. Normal structure of eye, clockwise, eyebrow, upper eyelid, pupil, iris, lateral canthus, limbus, lower eyelid, bulbar conjunctiva, lacrimal caruncle, medial canthus, eyebrow, upper eyelid, upper eyelid, pupil, iris, lateral canthus, limbus, lower eyelid, lower eyelid, bulbar conjunctiva, lacrimal caruncle, medial canthus, eyebrow, upper eyelid, pupil, iris, lateral canthus, limbus, lower eyelid, bulbar conjunctiva, lacrimal caruncle, medial canthus. Retina, Latin rete, net. A 10-layered, delicate nervous tissue membrane of the eye, continuous with the optic nerve, that receives images of external objects and transmits visual impulses through the optic nerve to the brain. The retina is soft and semi-transparent and contains rhodopsin. It consists of the outer pigmented layer and the 9-layered retina proper. These 9 layers, starting with the most internal, are the internal limiting membrane, the stratum, opticum, the ganglion cell layer, the inner plexiform layer, the inner nuclear layer, and the outer plexiform layer, the outer nuclear layer, the external limiting membranes, and the layer of rods and cones. The outer surface of the retina is in contact with the choroid, the inner surface with the vitreous body. The retina is thinner anteriorly, where it extends nearly as far as the ciliary body, and thicker posteriorly, except for a thin spot in the exact center of the posterior surface where focus is best. The photoreceptors end anteriorly and the jagged ora serrata at the ciliary body, but the membrane of the retina extends over the back of the ciliary process and the iris. The retina becomes clouded and opaque if exposed to direct sunlight. See Jacob's membrane, macula, optic disc. Choroid, a thin, highly vascular layer of the eye between the retina and the sclera. Choroid, a thin, highly vascular layer of the eye between the retina and the sclera. Choroid, a thin, highly vascular layer of the eye between the retina and the sclera. Sclera, Greek scleros, hard. The tough, inelastic, opaque membrane covering the posterior 5/6 of the eye bulb. It maintains the size and form of the bulb and attaches to muscles that move the bulb. Posteriorly, it is pierced by the optic nerve, and with the transparent cornea makes up the outermost of 3 tunics covering the eye bulb. Sclera, the tough, inelastic, opaque membrane covering the posterior 5/6 of the eye bulb. It contains the size and form of the bulb and attaches to muscles that move the bulb. Posteriorly, it is pierced by the optic nerve, and with the transparent cornea makes up the outermost of 3 tunics covering the eye bulb. Fovea centralis, an area of the center of the retina where cone cells are concentrated and there are no rod cells. See also macula lutea. Fovea centralis, an area of the center of the retina where cone cells are concentrated and there are no rod cells. See also macula lutea. Optic nerve, one of a pair of the cranial nerves that transmit visual impulses. It consists mainly of coarse myelinated fibers that arise in the retinal ganglionic layer, traverse the thalamus, and connect with the visual cortex at the optic chasm, and the fibers from the inner or nasal half of the retina cross to the optic tract of the opposite side. The remaining fibers from the temporal or orbital half of each retina are uncrossed and pass to the visual cortex on the same side. The visual cortex functions in the perception of light, shade, and objects. The optic nerve fibers correspond to attractive fibers within the brain, also called nervus opticus, second cranial nerve. Vitreous humor, a transparent, semi-iglationous substance contained in a thin hyoid membrane filling the cavity behind the crystalline lens of the eye. Some indications the hyaloid canal may persist in the vitreous humor, which is not penetrated by any blood vessels and is nourished at its periphery by vessels of the retina and the ciliary process. The vitreous humor is concave anteriorly to accommodate the crystalline lens and is closely applied to the retina around the walls of the eyeball, also called corpus vitreum, vitreous body. Vitreous humor, a transparent semi-glacious substance contained in a thin hyoid membrane filling the cavity behind the crystalline lens of the eye. Some indications of the hyaloid canal may persist in the vitreous humor, which is not penetrated by any blood vessel and is nourished at its periphery by vessels of the retina and the ciliary process. The vitreous humor is concave anteriorly to accommodate the crystalline lens and is closely applied to the retina around the wall of the eyeball. Vitreous membrane, a membrane that lines the posterior cavity of the eye and surrounds the vitreous body. Vitreous membrane, a membrane that lines the posterior cavity of the eye and surrounds the vitreous body. Vitreous cavity, the cavity in the eye posterior to the lens that contains the vitreous body and vitreous membrane is transected by the vestigial remnants of the hyaloid canal. Vitreous cavity, the cavity in the eye posterior to the lens that contains the vitreous body and vitreous membrane and is transected by the vessel remnants of the hyaloid canal. Vitreous, pertaining to the vitreous body of the eye located in the posterior chamber of the eye. Vitreous, pertaining to the vitreous body of the eye located in the posterior chamber of the eye. Vitreous body, see vitreous humor. Vitreous cavity, the cavity in the eye posterior to the lens that contains the vitreous body and the vitreous membrane and is transected by the vestigial remnants of the hyaloid canal. Vitreous humor, a transparent semi-iglaceous substance contained in a thin hyoid membrane filling the cavity behind the crystalline lens of the eye. Some indications that the hyaloid canal may persist in the vitreous humor, which is not penetrated by any blood vessels, and it is nourished at its periphery by vessels of the retina and the ciliary process. The vitreous humor is concave anteriorly to accommodate the crystalline lens and is closely applied to the retina around the wall of the eyeball, also called corpus vitreum, vitreous body. Vitreous membrane, a membrane that lines the posterior cavity of the eye and surrounds the vitreous body. Hyaloid artery, an embryonic blood vessel that branches to supply the vitreous body of the eye and develops part of the blood supply to the capsula vasculosa lentis. The hyaloid artery disappears from the fetus in the 9th month of pregnancy, leaving a vestigial remnant, the hyaloid canal, which persists in the adult as a narrow passage through the vitreous body from the optic disc to the posterior surface of the crystalline lens. The hyaloid canal, which persists in the adult as a narrow passage through the vitreous body from the optic disc to the posterior surface of the crystalline lens. Hyaloid membrane, Greek hyalos, glass, Latin membrana, a surface layer of the vitreous body of the eye at the interface between the primary and secondary vitreous, and at the boundaries of the hyaloid canal. Pupil, a circular opening in the iris of the eye located slightly to the nasal side of the center of the iris. Like the iris, the pupil lies posterior to the cornea in the anterior chamber of the eye and is anterior to the lens. Its diameter changes with contraction and relaxation of the muscular fibers of the iris as the eye responds to changes in light, emotional states, and autonomic stimulation. The pupil is the window of the eye through which light passes to the lens and the retina. See also dilator, pupillae, sphincter, pupillae, pupillary. Pupil, a circular opening in the iris of the eye located slightly to the nasal side of the center of the iris. Like the iris, the pupil lies posterior to the cornea, and the anterior chamber of the eye is anterior to the lens. Its diameter changes with contraction and relaxation of the muscular fibers of the iris as the eye responds to changes in light, emotional states, and autonomic stimulation. The pupil is the window of the eye through which light passes to the lens and the retina. Iris, an annular contractile disc suspended in aqueous humor between the cornea and the crystalline lens of the eye, enclosing a circular pupil. Smooth muscle fibers of the iris contract and relax to allow more or less light to enter the eye through the pupil. The periphery of the iris is continuous with the ciliary body and is connected to the cornea of the pectinate ligament. The iris divides the space between the lens and the cornea into an anterior and a posterior chamber. The involuntary muscle of the iris is composed of circular fibers and radiating fibers. Dark pigment cells under the translucent tissue of the iris are variously arranged in different people to produce different colored irises. The pigment is absent in albinos. In blue eyes, the pigment cells are confined to the posterior surface of the iris, but in gray eyes, brown eyes, and black eyes, the pigment cells appear in the anterior layer of epithelium and in the stroma. See also dilator pupillae, sphincter pupillae, iridic adjective. Ciliary muscle, a semi-transparent circular band of smooth muscle fibers attached to the choroid of the eye, the chief agent in adjustment of the eye to view near objects. It draws the ciliary process centripetally, relaxing the suspensory ligament of the crystalline lens and allowing the lens to become more convex. Ciliary process, any one of about 80 tiny fleshy projections on the posterior surface of the iris, forming a frill around the margins of the crystalline lens of the eye. The process compose one of the two zones of the ciliary body of the eye and are formed by enfolding of the various layers of the choroid. See also ciliary body. Ciliary body, the thickened part of the vascular tunic of the eye that joins the iris and the anterior portion of the choroid. It is composed of the ciliary crown, ciliary process, and fold ciliary orbiculus, ciliary muscle, and a basal lamina. Ciliary canal, the space of the iridocorneal angle. Ciliary ganglion, a small parasympathetic ganglion in the orbit of the eye which controls pupillary and accommodative reflexes. Ciliary gland, one of the numerous tiny modified sweat glands arranged in several rows near the free margins of the eyelids. The apertures of the glands lie near the attachments of the eyelashes. Acute localized bacterial infection of one or more of the ciliary glands causes external sites, or external styes, also called gland of Zeiss, comparatorsal gland. Ciliary margin, the peripheral border of the iris continuous with the ciliary body. Ciliary movement, the waving motion of the hair-like processes projecting from the epithelium of the respiratory tract from the certain microorganisms. Something totally different. Ciliary process, any one of about 80 tiny fleshy projections on the posterior surface of the iris, forming a frill around the margins of the crystalline lens of the eye. The processes compose one of the two zones of the ciliary body of the eye and are formed by enfolding of the various layers of the choroid. See also ciliary body. Ciliary zone, an outer circular area of the anterior surface of the iris, separated from the inner circular area of the angular line. The ciliary zone contains the stroma of the iris, also called zonula ciliaris, oricularis, or orbicularis ciliaris, one of the two zones of the ciliary body of the eye, extending from the ora serrata of the retina to the ciliary process of the margin of the iris. The orbicularis ciliaris, about 4 millimeters wide, and increases in thickness as it approaches the ciliary process. Orbiculus oculi, the muscular body of the eyelid encircling the eye and comprising the palpebral, orbital, and lacrimal muscles. It arises from the nasal part of the frontal bone, the frontal process of the maxilla in front of the lacrimal groove, and the anterior surface of the medial palpebral ligament. The palpebral muscle functions to close the eyelids gently. The orbital muscle functions to close it more energetically, such as in winking, also called orbicularis palpebrarum. Compare corrugator supercilii, levator palpebrae superius, orbicularis oris, the muscular. Oh, that's not anything. Well, it is, but orbicularis palpebrae reflex, a normal phenomenon elicited by forceful closure of the eyelids or attempting to close them while they are held apart, resulting first in constriction and then dilation of the pupil. Orbit, one of a pair of bony conical cavities in the skull that accommodate the eyeballs and associated structures such as the eye muscles, nerves, and blood vessels. The medial walls of the orbits are approximately parallel with each other and with the middle line, but the lateral walls diverge widely. The roof of each orbit is formed by the orbital plate of the frontal bone and the small wing of the sphenoid bones. The openings that communicate with each orbit are the optic foramen and the superior and the inferior orbital fissures, the supraorbital foramen and the infraorbital canal, and anterior and posterior ethmoidal foramina, the zygomatic foramen, and the canal for the nasolacrimal duct. Orbital aperture, an opening of the cranium of the orbit of the eye. Orbital fat, a semi-fluid adipose cushion that lines the bony orbit supporting the eye. Selective loss of fatty tissue caused by hormonal imbalances may produce bulging of the eye. Traumatic loss of the fat causes a sunken appearance of the eye. Replacement of the fat by tumor or abnormal tissue may be discovered as ophthalmologic examination. The examiner gently presses on the front of the eyes through the eyelid. Normally, each eye may be displaced 0.5 centimeters into the socket. Orbital fissure, the space between the floor and the lateral wall of the orbit, serving as a conduit for nerves and blood vessels. Orbital myositis, an inflammation of the external ocular muscle. The process, which is generally autoimmune, may be associated with pain, forward displacement of the eyeball, and paralysis of the ocular muscle. Orbital suital tumor, a specific inflammatory reaction of the orbital tissues of the eye, characterized by the exophthalmos and endometrius matus, congestion of the eyelids. Orbitography, the use of radiology to study the bony cavity containing the eye. Orbital medial line, a positioning line used in radiography of the skull that passes through the outer canthus of the eye and the center of the external auditory meatus. Cornea, Latin corneas, horny, a convex, transparent anterior part of the eye comprising 1/6 of the outermost tunic of the eyeball. It allows light to pass through it to the lens. The cornea is a fibrous structure with 5 layers. The anterior corneal epithelium, continuous with with that of the conjunctiva, the anterior limiting layer, Bowman's membrane, the substantia propria, the posterior limiting layer, Descemet's membrane, the endothelium of the anterior chamber, keratoderma. It is dense, uniform in thickness, and non-vascular, and it projects like a dome beyond the sclera, which forms the other 5/6 of the eye's outermost tunic. The degree of the corneal curvature varies among different individuals and in the same person at different ages, and the curvature is more pronounced in youth than in advanced age. Corneal abrasion, the rubbing off of the outer layers of the cornea. Corneal corpuscle, one of the fixed, flattened connective tissue cells between the lamellae of the cornea, also called keratocyte.